Welcome to the Hair Loss Show, and in this series of episodes we're going to do some Q&A sessions, and we've got some questions from viewers, so we'll get through those shortly.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, and thanks again for watching. Please remember to subscribe and like the channel. As you know, as I mentioned before, we're going to do some Q&A. Now I put up a post saying, please submit your questions, and we were overwhelmed with questions. Too many to go through. So what we're going to do is we're going to split this taping, and we're going to take a few questions at a time and try and get through as much as we can. But absolutely, we won't be able to get through everyone's questions. But again, I'm so grateful. Thank you very much for submitting your questions. And if you like this format, we will and can come back and do more of this in the future. So we'll go through a couple of questions that people have submitted. So the first question from Toned with TJ. He's actually a patient of ours, and he says, hi, I've had 2 FUT procedures at your clinic with great results. Just to clarify, 2 questions. One, is transplanted hair relatively safe from further loss and permanent, seeing as though it was harvested from the safe zone? And second question, what is the maximum density we can restore? Do you risk losing some of the previous density or transplanting, trying to get too greedy, trying to get even more density? All right. So thanks very much for the question. It's a great question. And we'll take each one in turn. So we talk about, when we do a transplant, we talk about taking hair from the donor area, which is the safe donor area. So this is an area on the back part of the scalp which is genetically safe from experiencing male pattern hair loss. And we know that over time that's generally true. So any hair that we transplant, you're not changing the genetics of that hair, you're just changing the geography of that hair. So for all intents and purposes, yes, any hair that you transplant should be there for long term. Is it permanent, as in will it never go away? Well, that's probably less clear, because we know that all hair on the body, and certainly all hair on the scalp, certainly experiences some form of thinning over time. It's an age-related thinning. So even in hair that is in that pure safe donor area will experience some thinning. And so an area that you transplant into, whilst initially may look very dense, may over time start to look more deplete. So there's no such thing as permanency. Every hair on the scalp certainly will experience some degree of thinning in terms of hair shaft diameter over time. And TJ's second question about what is the maximum density that we can restore? Well, the truth of the matter is that we can never mimic Mother Nature. Mother Nature's too good. All right, so we can try and pack as much density as possible, and there's no clear-cut answer as to what that figure actually is. It will depend on how thick each graft or hair follicle actually is. That will determine the number of grafts that we can place into a particular area. But I think that's probably the less optimal way of viewing that question. It's not how many can we put in a particular area, it's how many should we put in a particular area. And that really depends on pre-existing density elsewhere on the scalp, because you want to try and match that. There's no point in trying to put maximum density into the particular area of the recipient area if other areas on the scalp look less dense. You want to try and mimic that density, and that will vary with again with hair shaft diameter. It will also vary with the color of the hair, the skin color contrast, and also the nature of the hair. If it's curled, you might need less density than in someone that has very fine straight hair. So I hope that answers that question. I know that's a little bit vague, but it really depends on the individual. All right, but you have to be careful if you're transplanting with too much density into an area, because you may cause shock loss and damage existing hairs in that particular area. So I hope that answers that question. So that's question number 1. Let's go to question number 2 from Michael Williams. Thanks for your question. What I found on your videos combining minoxidil and 1.5 millimeter microneedling significantly stimulates hair growth, but I'm unsure how frequently I should be microneedling and when purchasing a needling pen, whether a high, low needle count is most beneficial. All right, thanks for all your videos. Michael, thanks again for your question. And we get this question quite a lot. And again, I don't want to be very prescriptive in this. Certainly, combining stimulation therapy, which is minoxidil, with another form of stimulation therapy, which is microneedling, can be additive in nature. All right? You want to do it often enough that it results in stimulation of that hair. Now, how often is that? That varies from person to person. Some people don't need as much, some people need more. But certainly if you don't want to do it too excessively, because you don't want to cause problems. You don't want to cause overstimulation of the skin, maybe potentially scarring. And that has impacts on the needle size as well. The greater the needle depth, the more likely you will cause damage, such as bleeding, and then further scar tissue formation. So it really depends on the nature of your skin characteristics that will determine what sort of microneedling device you need. And then obviously with the density of needles, well, I guess you could, maybe more is better because you reduce the number of times you actually have to roll over a particular area. But if you have slightly density on the wheel, then you may just need to do it more number of times. So there's no real, oh look, this is the best device and this is the best frequency. It really depends on your individual characteristics and how you respond. But certainly combining the two therapies is beneficial. All right, so I hope that answers that question. And a third question from Arjun, should we get extensive or some form of blood work prior to starting Finasteride, especially if you're young, under 20? All right. So in our practice, we generally don't do blood work prior to starting someone on Finasteride. But in this case, Arjun, if you are under 20, then I probably would recommend baseline bloods. Not because I'm concerned about what the effect Finasteride will have on the system, but more so if you're that young and you're losing hair, then you want to exclude other causes of why this may be happening. So it's beneficial to get baseline set of bloods, check things like your iron, your vitamin D, and check your liver function and your thyroid function as well, and make sure those are all optimized before you start empirical therapy with Finasteride. All right, so that concludes the first session, the first video of the Q&A. Over the next couple of days, we'll be releasing the second video and going through more of your questions. Thanks again for watching, and we'll see you on the next episode. Take care.